So before we begin, you're going to meet amazing people that will be participating in the panel, but I did want to ask Alyssa Chandler to stand up. I just been informed, go ahead, stand up and face your colleagues. Melissa also worked on 5B, was hired by Allison. So we wanted to shed some glory on her as well. So at this point, I'm pleased to introduce Carol Trestin. Carol was introduced to us through Allison. She's the executive director of the Association of Nurses in AIDS Care, and she's just such a lovely person. And I would love to welcome you to the podium, Carol.
Thank you. Thank you all for being here today and for watching the movie. And I heard some sniffles. Yeah, I think everybody's got the allergies, right? Yeah. So I'm the executive director of the Association of Nurses in AIDS Care, and I am a nurse. The Association of Nurses in AIDS Care actually is very connected to this film because, as you can imagine, not only do we share that area of interest and expertise, but the nurses in this film were some of the early members of ANAC. And in fact, Cliff Morrison was our second president. So this film really represents a lot of what we are about. And certainly this film is so remarkable because it really shows nurse innovation and nurse compassion, right? So many things that we take for granted now really emerged out of 5B. I mean, if we think about open visiting hours and defining your family as you see fit and bringing food in from home and even bringing pets in and having a life inside of healthcare, we take that for granted now, right? But well, some of you probably don't remember prior to 1981, but that didn't exist. That totally didn't exist. And you also were told not to get close to your patients, right? And not to connect with your patients. And this certainly has broke that barriers to now that's the standard in healthcare. And I want to thank Allison and the other nurses there for really pushing that forward in ways that we are all grateful for. So this was the first of patient-centered HIV/AIDS. Of course, there was no HIV then, it was AIDS. But this was the first of patient-centered nurse-led AIDS care centers, but it wasn't the only. In a few years, there were sites across the country, including here in Philadelphia, where nurses led very patient-centered, humanistic, family-centered, however that family is defined, comprehensive care for individuals with AIDS. And it happened here in Philadelphia. And so I have a personal connection to this movie. In 1986, I started the AIDS program with a physician and a social worker at St. Christopher's Hospital for Children in North Philly, and stayed there till 1999. This is the fourth or fifth time I've seen the movie, and I still get the sniffles. I still feel it every time. I get the feels, as they say. And I'm incredibly grateful to have been part of that and to have had the privilege to be part of that, because it really touched and spoke to the essence of nursing and what nursing is about. Evidence-based care, we certainly saw that in the film, right? Compassionate care, advocacy for your patients and for your communities. You know, the real core of nursing that we carry through today, regardless of what specialty area or field we're in. And so certainly the similarities to COVID-19 can be drawn. And I think we all saw that today, and we understood how nurse managed care, thinking about evidence-based infection control, it's sort of the opposite of what was in the movie, right? I remember our infection control director at St. Chris tearing down the red signs that used to be up in front of people's rooms. And the commitment of nurses to evidence-based care and to combating misinformation, which we saw it there, but certainly that's part of COVID-19 care. But one of the things that struck me today is one of the big differences is the important role of nurses in our patients' journey to death. and how important that was and is important for many of us, especially as we think about what we saw in the film, is to be able to touch, hold someone's hand, be there, provide the support that they and their family, however that is defined, requires, and how different that has been in COVID, right? Where that the barrier of technology, the barrier of really stringent infection control that may or may not have been fully warranted, has really impeded that nursing role in the journey to death. But I think that what this showed and what we all experience is the value of nursing excellence, and how that role of nursing excellence is across many, many domains. And this film and the experience of the nurses in 5B really demonstrated that. Compassionate care, evidence-based advocacy for our patients and our communities. And I want to thank Alyssa, Allison, and the team and the filmmaker who really showed that. Brandon, thank you for really portraying that on the scene. So again, grateful to open up this session around nursing excellence. I think that's about it.
I am now thrilled to introduce Linda Benton, Senior Director, Strategic Initiatives, Global Community Impact for Johnson & Johnson. Linda will begin with remarks and then moderate our panel discussion, which will include reflections on the film and nursing. And then today's panelists, Brendan Gall, Global Chief Content Officer, Media Brands, the producer of 5B, and the 2022 JCN Honorary Degree recipient. Allison Moed Palercio, Head Nurse, AIDS Ward, San Francisco General Hospital, featured in 5B, and Mary Beth Edger, Senior Vice President, Patient Care Services, and Chief Nursing Officer, Thomas Jefferson University Hospitals Incorporated, and recipient of the 2022 JCN Distinguished Alumni Award. So welcome to the stage.
Keep my phone with me to keep me honest on the time and don't go over. But I'm Linda Benton, as you just heard from Ann Marino. Thank you for that lovely introduction. And I couldn't be happier to be here in a room with all of you as a room full of nurses during National Nurses Week and as part of the larger National Nurses Month. I will tell you, I'm not a nurse by background, but I'm your biggest advocate you're going to find, I think. I think I've got the best job at Johnson & Johnson. I've been here 31 years. Spending over 20 years in the pharmaceutical sector, but throughout my career, I have had the benefit of working with so many nurses, and I just get choked up about this. I can't tell you how important you all are to us as a company. So I'm really thrilled to be here with all of you today, representing J&J in our 125 year, I know the film says 120, it's 125 years this year, commitment to the nursing profession. We truly believe that you all are the backbone, the lifeblood, and the heart of healthcare. And don't you ever forget that. You are scientists, advocates, comedians, problem solvers, diplomats, dot connectors, teachers, healers, innovators, listeners, pioneers, and groundbreakers, as you just saw in the film today. We also know that the communities that you care for don't honestly, I think, typically understand the broad and the deep impact that nurses have in everyday health care and the delivery of care. And I will tell you personally, I get upset when I see television shows that misrepresent what nurses do and the impact that you have. So why did J&J commission the film 5B? For that very reason. That we wanted to really show the real way that nurses, real nurses, have been stepping in to lead, to innovate, and to provide patient-centered care, and to really demonstrate the impact that you have in healthcare every day. So thank you for having me here today. And I'm really honored to be here with the panel to ask some questions. And we're gonna spend some time with us, some formal questions, and then we're gonna open it up for any questions that any of you might have from having watched the film for the first time. And I have to say, I think I'm emotional because every time I watch this film, I bet you I have seen it 100 times. It gets me every single time. And I know what's going to be said, and I know what's coming, and I know the funny parts, and I know the sad parts, and it get me every time. And because it's so personal, and it's mind-boggling how people conducted themselves. But I was saying earlier, people conducted themselves poorly in the 80s, and we still see that today too. Anyhow, we're going to get on with our Q&A. So again, thank you for having me here today. I'm going to start with Brendan. So Brendan, with this film, the question for you as one of the producers of the film, how did we find this compelling story? What was the process behind that?
Sure. Thank you. Thank you all for having me here today. I also was so emotional watching it today. I think
you were rubbing off on me.
I know it was this row here, right? Tears on tears, contagious. But I think being here with Allison, we hadn't seen each other in person in some time, and then also being here with all of you. This is a film that was made for nurses. It was made for nurses, but for the public to understand nurses in a more real way, and the opportunity for impact from nurses when the right people are there to respond to the moment. But to your question, how did we find it? So you heard I'm Global Chief Content Officer at Media Brands. It's a advertising and media company that has done a lot of work with Johnson & Johnson for many years. And, we got to conversations around why there was a certain perception of nurses. And as Linda alluded to, it was because the way that nurses are portrayed in film and TV. And we knew that strategically, if we wanted to show nurses as the hero of a story, we needed to find a big dragon to slay. And at that point, we went into a number of rounds of research. And, at the time, the team working on it thought that it may be around nurses that were responding to a natural disaster, or nurses that were responding to a school shooting. And when we found the story of 5B, we knew that we really were onto something. The thing that is tricky in documentary filmmaking is you have to have first the story, and then you need to have the subjects that'll talk about it, and you have to have the footage to back it up. Otherwise, you can make a podcast, right? So we went through the process to make sure that we had all the elements, and then we brought it back to Johnson & Johnson, and we said, to reach your objective of elevating the nursing profession in the form of a film, we recommend that this is the best story for you to commission. And I tell this story all the time. It was one of the scariest calls of my professional life because, again, we thought that it was going to be something that was a little more current, from a current event standpoint. And midway through the call, the client on the phone stopped me and stopped the call and said that she didn't need to hear anything more about the story. And I thought this was not going well. And she said that she didn't need to hear any more because she knew the story, and that she had worked at J&J for over 30 years. And that in the 80s, J&J had actually asked her to go to the ward to see if there was anything they had that could help. So there was also like an intrinsic connection for them and the film and the story. And it was that moment where they said, this film has to be told. And then we were off to the races.
Love it. Thank you. Allison, I'm going to move over to you. When you think about what's happening, certainly today with the pandemic, and we've all heard the statistics in relation to burnout and, just the incredible demands that it's put on, all frontline health workers, I think, especially nurses. When you think about what you had to lead your team through during the crisis, tell us about what that was like. How did you do it? How did you keep them going?
How did they keep me going? and really, I want to start by saying, thank you so much for all your thanks. You've all been so gracious in saying, thanks for coming here. But I love to come and speak with nurses because really this film is not only about the nurses on 5B, but it's about all of you. And so it's where the film is really describing nursing in a particular period of time at a particular moment in time. But really what we were doing is what you all are doing all the time. So thank you. I'm really glad to be here. Thanks J&J for making this film. Thank you, Brendan. So how did we stay resilient?
Mm-hmm.
How did we go? I think that first of all, we had passion. Passion brought us there. We chose to be there, all of us. We chose to be doing this work. And we started without knowing what would unfold or what the future would bring us. We started only with our vision and with our love and with an idea of what nursing could be, because this was an all-RN unit. And it was the first all-RN unit that any of us had worked on. And we just thought, we can design care. We can be the authors of what happens here. And we quickly learned that we were not the authors. The disease in its way took over a lot of control. So how did we deal with that? Well, as I said, our dedication, our passion, our really strong desire to rectify the wrongs that we had seen in caregiving was propelling us forward. Our compassionate hearts, our desire to bring ease and healing to these basically young people who were being almost tortured. There's just an unfolding series of diseases and illnesses and indignities that were unpredictable. There wasn't control. And resilience does have a lot to do with feeling as though you have control over your environment. So how did we gain that element of control? Because we nurses stayed for a long time in this work. And I think that the way we could feel that we had some control was to dictate the kind of care that we would give. And we learned that actually we weren't dictating. We could learn from our patients. We learned incredible amounts from our patients about how to give care. And we had endless arguments about a nursing care plan. Can you believe it? We wanted to make, do you remember? We wanted to have a standardized nursing care plan so that anyone would understand and learn from our experience. And it could be applied to AIDS patients everywhere. So we did. We made this incredible pages-long nursing care plan addressing every conceivable facet of AIDS patient care in that day. And that helped to enliven us, to know that we were giving good care. That was really, really important.
I'm guessing aligned to your purpose, right? That's aligned to your purpose.
Yes.
What you were called to do.
Yes, that is what we were called to do. And that's what we felt that we were doing. And so by taking charge of care and learning it from our patients, we felt that we had some control over our environment. I think that was a really huge part of our resilience. Our role as advocates, as being able to speak up for our patients, once again, not only on the unit and not only on people who tried to come onto the unit and to bring another standard. Maybe they were people in the hospital who wanted to mask, gown, and glove needlessly. Maybe they were a missionary group who somehow found their way onto the unit, and we could just as easily escort them off the unit if they were speaking inappropriately to our patients. We could, and then to the press, as Hank learned, we actually welcomed the presence of the press onto the unit. It was really iffy because we had to provide nursing care. Our patients were really, really sick, but we wanted to put out to the world what our vision of care was. And we wanted to humanize our patients who were seen as a stigma. They were seen as a disease. They were seen as gay men and by many people who were mystified and even terrified and scared of this idea of what a homosexual was. We wanted to show everyone that our patients were human as we all are, and that by the power of touching them, we could unify and sort of elevate our vision of all of us as human beings. I can go on and on, so I think I'll stop.
So take that. No, it's
was that. Oh, but I will say that certain things are really important. Self-care is really important on a unit. Having time off was a huge deal. I spent hours on, and this is probably automized by now, but I spent hours on the time schedule, ensuring that everyone got the time off that they needed. And we learned what to do during those hours that replenished us the most, so that we could come back and do the work. And then just this team that continue to grow stronger and support one another was a big part of our resilience.
Sounds like communication, team building, really pulling people together and making them feel valued, which I will tell you from market research that we have done today is not where nurses are today. So kudos to you, Allison. Mary Beth, question for you. When you think about what's happening today, what types of nursing practice challenges remain in today's practices versus what the 5B team experienced in the early 1980s?
Wow. First, let me say I'm just honored to be up here with both of you. So thank you very much for that. And I will tell you that you have revitalized the approach to patient care with what you did with 5B. So I think that, some of the challenges that remain now compared to the 80s and into the 90s with the AIDS pandemic, certainly we still have infection control issues. We still have issues with hand hygiene, something very, very simple, right? But we're working on it. And, we've done a lot since. And, some of our equipment with infections for ourselves and our patients, such as needles. As a result of AIDS and bloodborne infections, we've come up with the needleless system. So those things and universal precautions. That was something when I was a nurse back in the early 80s that, there were standard precautions, but you didn't wear gloves to start IVs or draw bloods, and you don't wear gloves to mix chemo. You just, we've come a long way in nursing. So, we still have those challenges. And the other thing I think is that we still, in a way, we isolate our patients when we know that there's something wrong with this patient that nobody knows what the cause of or what the treatment is. We still isolate those patients, and we may put them in those single private rooms, and, everyone's afraid to take the breakfast, the meal trays in. And, with the pandemic that we are still in the midst of right now, we've isolated all the visitors. So, our patients and thinking about the film, they really didn't have people come and visit them. And we did that. We do that now just to protect our caregivers and our families. But when those patients were at the final stages of dying, we did let families in to be with them at end of life, which I'm so happy that we did. And I think we've learned from the AIDS pandemic that they need that human touch. Human touch is extremely important. And in the film, and we know back in the 80s that our patients, the AIDS patients, until we had treatment, and I think the treatment took at least 2 years to come up with something. And, until we had that treatment, it really was caring, not curing. So it was about that compassionate and caring nurse and healthcare team that were the only ones that these patients had, unless they still had their partners or, they were lucky to have family that still cared about them. So some of those challenges do remain. And as you mentioned, the stigma that was put on the gay population back then, we have a challenge now. We have a stigma on the Asian community. And, some of our politicians, gave a lot of miscommunication in this era and back in the 80s to the world. So, it's not, you want to believe everything you hear, but you never believe everything you hear.
Yeah, great. Great. I know every time I see the film, and especially today, I think about the amazing parallels, as you mentioned, in relation to what happened in the film in the 80s and what we just lived through in the pandemic. And you all know about it better than anyone, but it's amazing how much there are so many similarities and things to learn from. So thank you for commenting on that. Going back to Brendan, I have a basic question for you because we get this question a lot when we do these sessions.
For sure.
How did you obtain that amazing film footage that took us right back to being there?
Okay. That's a good one. I definitely. And I also just wanted to quick say thank you so much for raising the point about human touch. And Linda and I were talking right before the panel started. The song that we made for the credits is called Human Touch. And it's actually an original song by Jackson Browne and Leslie Mendelsohn. And I would suggest you all go listen to it. Go find Human Touch by Jackson Browne and get quiet for a second and listen and think about this film. It's really a wonderful song. But the footage, so, as I was saying, that's one of the key things that you need in a documentary. And because we had Hank on board as one of the storytellers, and Hank had kept personal collections of all of his stories, he was able to give those to us to use in the film. And it was the choice of bringing people like Hank and Rita and Harry and others that were not nurses into the film as subjects to be able to talk about what was going on the ward that I think made it so impactful. But the other piece of it was we had found within our research that CBS had sent 2 crews at 2 different times to shoot short 60-minute segments over the course of the time that the ward was operational. And we had reached out to CBS and they actually went digging down in the basement on 57th Street and they found the boxes of the original tapes. And the tapes had never been played since the 80s. And, then it was like, oh my gosh, we have this treasure and we can't mess it up. Right. So we had to really dig into the science of how do we get the right equipment so that we can play it once, we can clean it, we can play it once, and we can digitize it so that we have it for all time. What's also really interesting about that is now that footage sits within the CBS license catalog. And if you saw the film, oh my gosh, what's the film? The Queen, it's with Queen and Bohemian Rhapsody. If you saw Bohemian Rhapsody, and I was sitting in the audience watching that film and was stunned at the end of that movie. The Freddie Mercury character is in his bathroom and he hears a news broadcast about this new disease. And he walks out and he looks at the TV and it's footage from the ward that plays on the TV that came from, it's actually in our film. And it's footage that we saved from the basement at CBS. But I will say the film in its form is so emotional for so many people. And this particular audience, being one of nurses, has firsthand experience in some of those environments. This was a very difficult experience and different experience, particularly for our editors, to watch all of those tapes it was weeks-long footage of people dying. And we had to really, when you think about, self-care is something that we've talked so much about, we had to really put in place a lot of mechanisms for self-care, particularly around the editorial team that had gotten to know these characters and watching all that footage for the first time. People hadn't seen this in many years. So I think while there are many films, or at least a handful of very good films about the HIV/AIDS crisis, the unique perspective here of the point of view of nurses and the fact that we have all of that footage that makes you feel like you're actually there at the time. It's not someone just telling you what happened, is what makes this film stand out and be as powerful as it is.
Awesome. Thank you. Didn't you have to do something? You had to bake the film too to make sure.
Yeah. So the film, it all had to be baked, right? So they literally cleaned it and then they had to like put it in this oven to make sure that it didn't crack when it ran through the machine.
Fun fact.
And it was like wild.
Yeah.
It was a whole, talk about innovation.
Yeah. I can't imagine when you found that box, how amazing that must have been. So I'm going to go to Allison, and when you think about, this film in its entirety is 94 minutes. And of course, the time that you spent on the unit spans much longer than that. Is there any aspect of what happened while you were on the unit that we weren't able to pull into the story that you think is important to share with the group?
Yes. Well, no, there are just a few striking. One was the role of the lesbian community. Many of the nurses that you saw on, and I feel that should be articulated. So just to backtrack a little, I've had friends, lesbian friends, tell me that in fact they literally could not get a cup of coffee, served a cup of coffee in the Castro, which is the gay area of San Francisco, the gay mecca of San Francisco, before the AIDS epidemic. After the AIDS epidemic, they really stepped forward. They stepped forward as nurses and as women to provide care. And many of the nurses that you saw in this film were gay women. And so that certainly needs to be articulated, because I think it because of their role and their advocacy role, their nursing role, they stepped up in the community as well as on the unit. So that's one really important piece. And then the role of the community itself was highlighted through Rita Rocket. But, Lorraine Day said that we received funds and we received privilege. And actually, we did not receive any more funds than any other nursing unit at San Francisco General Hospital, which is a public hospital in San Francisco. But we did receive outpourings of love from the community. And that, that is a model that was much appreciated and could be perpetuated. We got everything. We got everything. We got food, we got flowers, we had plants. And a lot of it we were very fortunate because a lot of this came from the gay community, and some of it was so artfully and beautifully presented. And it was actually contributed to our own feeling of well-being as well as to that of our patients. So we were able to welcome our patients onto the community onto the unit, and they brought robes and slippers and, yes, teddy bears for people who had no money at that point, who had nothing. And we had massage therapists. We started our own volunteer program, which of course was under the auspices of the hospital volunteer program, but was unit specific and provided very unit specific services. So those were the presence of the community, the presence of these very strong women who really made a difference in care were things that to bring out.
Great, thank you. Awesome. So Mary Beth, I'm going to close out and then we're going to go to the open Q&A with you. So in your role as Chief Nursing Officer at Thomas Jefferson, you think about this film and all the amazing lessons that were in it. What stands out to you the most that you hope that nurses kind of carry forward?
I guess the number one thing that stands out for me is the compassion that nurses bring to people. And, when I say people, I mean patients, but I mean their loved ones and their families as well. And I think to be in this profession, that each and every one of us, we mentioned it's our duty in the film. It's a calling to be a nurse. Nurses do special work. They have really difficult, challenging jobs, especially when, there's fear that, wow, I might catch that disease. I might bring that virus home to my family, but we just continue to do it. We are with patients 24/7. And, back in the 80s, I believe nursing was still the number one, still the most trusted profession, and still is. Patients trust us, and compassion is just one of those things that You got to have it in you. You're born with it. I don't think it's something you learn. You just you have to have it. And there are some nurses who don't have it, and they don't last. And you can tell who's compassionate and who isn't. But as the chief nursing officer, it's my goal and my hope that every one of our patients and family members are taken care of by the most compassionate, kind nurses who I believe majority of people at Jefferson are. And, we have a professional practice model, and we're guided by a theorist, Joanne Duffy, who talks about the caring behaviors. And, if you've got those caring behaviors as a nurse, you're compassionate, and you're compassionate toward people. And I believe that's what we need.
I'm so glad to hear you say that as a chief nursing officer, because I'm on a little bit of a personal mission. I think that compassion should be institutionalized. I mean, I think it needs to be acknowledged. And this is a charge for all of you newer nurses and nurses who are working now. It's our hearts, I agree, our hearts bring us largely into this profession and sustain us if we're going to remain in it. But I think that compassion is still viewed as a secondary quality. And in fact, compassion for our patients, compassion for ourselves, compassion for each other can form the basis of healthcare equity, which we haven't, even begun to talk about, and quality of care, real quality of care in the hospital. If we think about if we honor compassion and think about what we need to do to sustain it in terms of having appropriate equipment, even in a healthcare crisis, having systems of support for staff, I think we will move forward not only as a healthcare institution, but also as a society. So. Yeah,
I would just add that I do believe that competency and skill are also important components. However, as we said, that, it's not what you do or what you use or whatever, it's how you make someone feel. And that's where compassion comes in. So I would put it as, certainly right up there with skill. I think it's extremely important.
Love that. We're going to go to open questions, I think.
So we're now going to open it up for Q&A. I know there's probably a million questions out here, but just signal me and I will come over. Who wants to go first? Are we being shy?
Hi, my name's Maureen Kane. I am one of the faculty at Jefferson College of Nursing. And I think that we are at the foundation of nursing. And what we teach our students goes on with them throughout their career. And I always make it a point to make sure that I elude compassion, and having had family members who have passed, and even having family members who had COVID and they weren't able to be visited. That was one of the hardest things that I had to endure, was not being able to see my family member during that time of need. So the nurses were there. And I think our responsibility as nurse educators is to be compassionate. So I want to thank you. It's not even a question, but I want to thank you for the compassion that you gave those patients, because it was so touching and so genuine. And whenever I fill out, a reference for my students, when they ask me, I always make sure that I say they're compassionate. And, if they're not, I may not give them a reference. But thank you so much for the compassion and the care and the love that you gave those patients. So very touching. So very.
Thank you.
Any questions?
I just wanted to comment real quick, if I could. Thank you for your comment regarding compassion. And, you know, I and my colleagues, who many of them are here, had discussions frequently about visiting hours and visitors coming and whatnot. And, you know, we got it that, you know, we need to restrict them. And, you know, in times of end of life and things like that, when patients had taken a turn for the worst, we allowed those families to come. But later on, we had a discussion that, you know what, maybe we should have changed that and rethought it. Maybe everyone should have those families, because all the patients in the hospital were kind of alone, except for the nursing staff. And when a patient was dying and there was no one else there, our nurses were at the bedside holding their hands. So they did have somebody with them when that happened. But we really thought, like, you know, and this is probably maybe right after we got the vaccine, that maybe we should allow 2 visitors at the bedside again, because they help the patient heal and, you know, improve their health status. So, you know, I don't know. I think nurses really drive changes in healthcare. And that's maybe something that's a learning lesson when the next pandemic hits, that we may need to do things differently.
Hi, my name is Missy Halligan, and I am new to JCN and feel, you know, very privileged to be a part of the nurse educator group. I have a history in palliative care, pediatrics, and simulation. So all my loves coming together. And I have to say, it was so refreshing to see the first palliative care unit, really, everything that you did to provide that amazing quality of life for whatever time they had. And thank you for really introducing that, I think, to the world and how important it is. And, you know, in pediatrics, we do that, you know, like listening to all of those things. I'm like, oh yeah, that's, you know, from the days that, but I know that in adults, it was a little bit different. So that's just such an amazing gift that you have given really the world in general. My question though, is really about how do you, I guess, as somebody who is a pioneer in doing this, how do you envision us moving forward with creating that learning opportunity for compassion and empathy for the students in this world today? I feel that there is so much anger. And when you talk to even just your friends and they're just like, oh, we went to the store and the person in front of me is blah, 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 blah. And there just is so much anger since this pandemic. And and you see it, like you see it from the students, because then they come in and they're like, arr, and you're just like, whoa, wait, and you see it in your own family, right? How do we start to break those barriers down, to get back to that piece of compassion and empathy that we need to do as human beings, and then kind of breeding it into this younger generation? And do you have any thoughts on that? I know that's a big ask.
It is. It is a big ask. It's something I think about. I think we have to start with ourselves individually. I think we all have to look at ourselves and see where we're coming from. What are we afraid of? What do we hate? What is making us angry? What is stopping us from sharing the best parts of ourselves with others, whether they're people we love or whether they're people we meet in the course of our day in the supermarket. So that I think that's the first thing, because we're seeing now we're all reacting. Many of us are reacting from places of fear and from really the darkest parts of ourselves. So I think we have to start with square one. And I think that makes a difference. I have to think as a person, older, and some would even say an elderly person, I have to say, that's where you have to start. But how you bring that forward through a school, I think you need to start articulating these concerns. Ask them, ask these students, where are they coming from? There must be exercises that can bring some of this out. I'm sure there's people, consultants who could help you with that, but start the conversation is what I would say. Start it from square one, and then bring that forward. Become advocates in your places of work, wherever, whether it's an educator on a unit or in an academic setting. Bring that forward. Advocate. Articulate. Find champions, find mentors, find supporters. Create the team that can get back to that foundation, can get through those fears, can start utilizing not only their hearts, but some of those incredible skills and knowledge that we have in a fair way, in a way that's not ruled and affected by fear. And that's where I would start. And you educators, you administrators now, you have your own special brands of skills to bring all that forward out into the world and to make a difference. And then I would say, vote your butts off for the people who are looking for what you believe.
Yes. And I would just like to add that I totally agree. I think it starts by the leaders being the role models. We have to demonstrate to our staff, that we are compassionate, and some of the anger. I mean, the nurses that worked in the recent pandemic that we're still kind of in, it took its toll on them. They worked morning, noon, and night. And, we've all heard of the Great Resignation. And, that hit, I think, with the beginning of the second wave, where we were losing nurses who were burnt out and had it, or they were leaving to take on traveler jobs, agency jobs, where they were making big dollars. But I think that the toll that it has taken on our nurses has caused anxiety and depression. And, many people were either, drinking more or started drinking if they didn't drink, or just doing things like trying to help themselves to cope. But I think, and we've realized this, and it's important for the educators in the universities and colleges to really look at the resources we have available for our staff. And we learned, I think, from maybe the first pandemic, but a lot in the second one that we're in now, the COVID pandemic, that we have to have those resources available, mental health services, the RISE program, which is a peer program where you can call them at any time and there's no questions asked. They just reach out to you just to make sure you're okay. And if they feel you need additional referral for mental health or whatever, they will do that. And, now I'm looking at our compassionate dog right here, Maggie. And if they're really upset and angry and anxious, we call for Maggie to come and make a visit to them. But we need the resources out there. And, we can get more if we all vote. And depending who we put in office, to get those resources to help our healthcare workers, because everyone needs them. They really do. And even if we think the pandemic hasn't taken its toll on us as leaders, it has.
If I could just jump in for just a moment, I should have mentioned this when I spoke earlier. We do have 5B out as an educator's toolkit through AACN. We supported some work for them through a grant. So it's made for nurse educators to use with your students as a teaching tool. You can see the whole film. There's questions to ask, short snippets, etc. So.
Thank you, everyone. My name is Mary Hanson Zalot, and I'm the Associate Dean for Academic Affairs at the College of Nursing. Very proud to have that role. And I thank you for all of your comments and the inspiration that you've provided for all of us, especially those of us who have been at the front lines and worked with such a unique group of individuals during the early 80s. I mean, it was truly quite the challenge, and I've learned so much from that experience myself. But my question today really comes from, I guess, a leadership perspective. And I recall reviewing an article a couple months back that had a statement in the article about speaking about nursing and the pandemic and almost the danger of debrief. And I remember calling on one of my colleagues, Dr. Kumar, not sure if Dr. Kumar is here. Oh, I see her, Parna, thank you. To ask her, is there danger in debrief? How can there be danger in debrief if we're talking about nursing and the stress that they're under and talking and having conversations? How can that be dangerous? And she very thoughtfully provided an explanation from her mental health perspective background. But my question for you is, as a leader and manager during that time frame, what prepared you to be able to debrief with your team and to provide them with what they needed to continue to do the work that they were doing?
What prepared me? Nothing. To say perhaps my life experience, perhaps, and my professional experience. I had been a nurse manager on at the Brooklyn VA on a drug detoxification treatment unit, and our focus there was on group therapy and discussion and expression of feelings. So I had that kind of background. The nurses, and I don't know if this is true at present, we had a formalized support group in nurses. When I became nurse manager, the first thing the nurses said was, we don't want to go to support group. So I loved support group. So then it became a question of what are other ways for nurses to debrief, and so we had to find informal ones. There were more formal ones like employee assistance programs, mental health counseling that can be available in an institution that you can encourage people to participate in. We did a lot of informal debriefing. We had a communications book that we've shared between shifts that didn't really necessarily have to do with clinical issues. It was separate from nursing report. That is, of course, routine. We had a bulletin board in the bathroom, in the staff bathroom, which consisted of one stall, and we wrote all kinds of things on that. There was all sorts of debriefing that took place on that bulletin board, right? We, as you saw, we met in the hallways and embraced. We had a culture that encouraged crying and that also encouraged celebration and laughter. So we did it all. We weren't afraid to cry. That being said, there were people who, as we said in the film, who used drugs, who used alcohol, diverted drugs. We had those problems on our unit as well. And in that day and age, there wasn't a whole lot of support from me as a manager in terms of dealing with staff about the difficulties of working, of work life, which abound on every unit, no matter what the nature. So I think we've actually come a long way now. And I don't know the dangers of debriefing. I'm all for it. So, and I think we have a lot more resources now than we did back in that day.
And on a related note, we have a question from one of our virtual attendees who inquires about mental health resources, if any, at the beginning of the AIDS epidemic. We've touched on for the staff and the clinicians. Were there any resources that you saw or were being implemented for patients?
Oh, we were so fortunate. And thanks for mentioning that, because I didn't think about it woefully when you asked me, Linda. We had Shanti counselors on the unit. And bless Cliff, because he had taken the Shanti training. Shanti was an organization that was providing practical and emotional services to people, largely people with cancer, at the time that the AIDS epidemic became evident. So Cliff had happened to go through this not happened to, but he deliberately had undergone the Shanti training. And he saw to it that, and you actually, she was one of the nurses you saw in the film, that Linda Maxey, who was a nurse, but had become very actively involved in Shanti, was a paid, because Shanti was a volunteer organization. She had a paid position on our unit. And Linda had a small team then, but that team grew. So we had these Shanti counselors on the unit who were well informed about talking with patients about their feelings at the end of life. We also became adept at raising end of life issues with patients. But Shanti had a particular role on the unit for patients, and that was extremely important. I will acknowledge and say also that we had a chaplaincy service that was hospital-based, that was non-denominational, and that was non-prejudicial, and that came onto the unit and provided excellent, wonderful chaplaincy services to those patients who were interested and wanted that kind of care. So we were very fortunate.
Hi, my name is Ingrid Hillman. I teach at the College of Nursing. I wanted to say thank you for entertaining all of our questions and for sharing with us. One thing that stood out to me with this current pandemic is the fact that families were concerned that things are going to be brought home, right? So the nurses, there was concern for the families that whoever the care providers were, they were going to bring home AIDS. And that also happened now with our pandemic. My one question is this an opportunity for like 5B Part 2 for J&J to commission a movie based on what we just went through with the pandemic? Maybe not right now, but in the near future, because for many people, they feel that they've moved on from the pandemic, but in healthcare, we still see the impacts and we feel the effects, and we're still living the pandemic. So there's a disconnect between what society sometimes is seeing compared to what's really happening inside the hospital walls. So is there an opportunity for like next steps, a continuation for the impact of this pandemic? Because so much of the comparisons have been to the flu epidemic, the flu pandemic of the 1915. But we had a modern day epidemic with AIDS. So that's my one question. And I just want to acknowledge you're wearing Jefferson blue. So you fit right in with us.
Yeah. I would say we're talking about it. We're thinking about it. There's obviously a lot of things to put into consideration, but you raise a very, very, very valid point. And I personally would love to see us do it.
If I could also say, I think the thing that's different now than then is that in the 80s, you had kind of the TV reporters for the way that you were capturing the footage. Whereas now production is far less expensive and moves really fast. So there's actually already a few films out there. There's a film called The Surge that was commissioned by Mount Sinai Hospital in New York that is on Discovery Plus, if you're interested in that film. I think that while there's certainly an opportunity to do a piece that ties both pandemics together, I believe as a filmmaker, the strength of this film is the distance from it, because we've learned so much and there's so much reflection that is in the film. So I would say, I think yes, but it might still be too soon. But if I can ask a question, because Allison, you hadn't revisited this period for a long time. I mean, it's always with you, but what was it like when we called and said that this was something that we wanted to do? I mean, I remember the day that we brought everybody together to show the film for the first time to you. And like, I couldn't breathe. I wanted nothing more than to make sure that we did service to your story. But I've always been curious, what's it like when people that you don't know call 25 years later and say, hey, do you want to talk about that really hard moment?
So many years later, yes, it's a really hard moment, but it's still with me. It was a call out of the blue. It was. I remember Teresa, and she was looking for Cliff, and Cliff had a death in the family, and he was not reachable. He was, involved with family stuff, and she had a professional phone number. So she started talking with me, but the researcher was so obviously moved by our experience. And I think the fact that she was approaching from a point of view of compassion and real interest made a difference to me. She really wanted to honor our experience. She really did. And I could feel that. It was, more than a thinking thing, it was a feeling thing. So I began, I thought, maybe this could be something really important. And so I spent a lot of time on the phone with her, and also a lot of time contacting people. She spoke to many, many people. And I think we all had many people who did not end up being in the film itself. And I think we all had a similar experience. When you live through something that moves you deeply, I'm just thinking about this now while I'm talking to you. I think there is a desire to talk about it, to share, to commemorate that time that so many have forgotten, so many don't know about, so many members of the gay community don't know about. So it was also an opportunity, maybe, one never knows, to talk about that, to bring it out into the world again so that it could be remembered. It's a way of remembering. It's a way of honoring those who died. And it's a way of acknowledging the work that we did. So there was that hope. And then the film got made. No one knew if those of us who had been filmed, whether we were actually in it, or were we, on that proverbial cutting room floor, and if there is such a thing anymore. But I remember, yes, that evening, we had great trepidation because how many times, and Alyssa would know that, the media came in and we told the story, and what got printed in the papers was not the story we had told. So we didn't really know what the film was going to be about. And you were very moved. It was you were selling to a heart crowd, let me say. And you were very moved, and we were very pleased. We felt, and very relieved, to tell you the truth.
Me too.
I'm just going to ask you to stay up there. I'm going to come back up. Maggie's behaving now, so.
We realize we're going over what the program time was, but we ask if all of you could stay, as we have an award presentation that I think you'll be interested in supporting.
Okay. Thank you, Linda. I would like to now recognize a JCN alumnus who has demonstrated resiliency, teamwork, and commitment to caring for others through her incredible career and accomplishments. The Jefferson College of Nursing Distinguished Alumni Award recognizes prominent professional achievements and outstanding contributions in the areas of education, research, practice, and/or service to the profession by a JCN graduate. It is my pleasure to announce Mary Beth Edger, Dr. Edger, Senior Vice President of Patient Care Services and CNO of Thomas Jefferson University Hospitals, as the recipient of the Distinguished Alumni Award for 2022. Mary Beth earned both her Master of Science in Nursing in 2009 and a Doctor of Nursing Practice in 2018 from Jefferson College of Nursing. And her professional contributions to nursing, and more specifically to Jefferson, have been nothing but extraordinary. Mary Beth started at Jefferson Methodist Hospital in 2004 and has held a wide range of responsibilities during her tenure here, including CNO at Jefferson Methodist, nursing professional development at JUH, and oversight for ambulatory services. She's the secretary of the board for the Southeastern Pennsylvania Organization of Nurse Leaders. Currently, Mary Beth directs strategy for nursing practice, quality and safety outcomes, and professional development, and is a key member of the Enterprise Executive Nurse Leadership Council. As the divisional CNO, Mary Beth works closely with enterprise leadership to drive nursing's operational initiatives and is critical to our ongoing success in meeting our mission of improving lives. On behalf of the entire Jefferson College of Nursing team, congratulations to Mary Beth. We are so proud of the impact you have made and continue to make every day.
Thank you so much for that. That's beautiful. So thank you, everyone. Thank you, Dean Marino and the faculty of Jefferson College of Nursing for this prestigious award. I'm honored and privileged to be selected as the recipient of the 2022 Distinguished Alumni Award. When I started at Jefferson over 18 years ago, I had a master's in health administration. So I did have a master's, but I always wanted to get a master's in nursing. And I knew that someday I would return to obtain my MSN. So the opportunity presented itself in 2007 after the kids were like in high school and whatnot, and some in college, when I was accepted into the Community Systems Administration master's program. And I was so thrilled and excited not to just be going back to school, but to be going to Jefferson. And my father, God rest his soul, was a physician and a graduate of Jefferson Medical College. Actually, he was a nurse before a doctor, but he graduated as a doctor. And, you know, he was a true Jeffersonian. He was just so proud of Jefferson, talked about it all the time. And I just felt so proud to tell him that I'm going to Jefferson. So, and he was excited as well. So he truly inspired me. And almost a decade later, I decided to return to Jefferson to obtain my doctorate in nursing practice, which I did and finished that in 2018. And I wanted to say that I just met so many wonderful people along the way. And then so many of you may not know it, but you had an impact not just on my career, but truly on my life. You've all contributed in some way to make me the leader that I am today. And as we all know, a leader cannot lead alone, right? No man's an island. We just can't lead alone as a leader, especially in times of uncertainty and chaos like this pandemic with COVID-19 and the tragedy that I and my staff and my colleagues experienced in October of 2021 here at Jefferson. And I want to say about being a leader that can't lead alone, my team carried me and each other through this very difficult and heart-rending time. And amazingly, we got through it. You see, my team is made up of very special people. And right in this row and the one behind, a lot of them said, John, Scott, Monica, Dennis, Joanne. I've worked with other teams of people from my division, with the enterprise, with 13 other hospitals, now 18 Jefferson hospitals, and the faculty from the College of Nursing. And I continue to learn about leadership from each and every one of you. You have all made a difference in my life as a leader. I'm sincerely grateful and appreciate every one of you. Again, thank you for this recognition and this amazing award. And today is May 12th. It actually ends Nurses Week. So happy birthday to Florence Nightingale and to the end of Nurses Week. And thank you again, everyone.
Now it is my pleasure to announce this year's recipient of the Jefferson College of Nursing Hero Award. We present this award not every year to individuals, teams, or organizations that make extraordinary contributions to improve lives and positively impact their communities. A JCN hero is selfless. A JCN hero inspires others with their courage to persevere through what is today. And ultimately, a JCN hero makes everyone's tomorrow a better place. It is my pleasure to announce Allison Moed Palacio, head nurse, AIDS ward, San Francisco General Hospital, as the recipient of the JCN Hero Award. I just want to say just a couple of more things about Allison, because we heard about just her work through her feature in the film. But Allison, a New York native like myself, we actually lived we grew up not too far from each other. We found out last night, Queens girls. So shout out to Queens. She earned her nursing degree in New York, spending 5 years working as a nurse at the New York VA. She relocated to the Bay Area in 1979, becoming one of San Francisco General's first per diem nurses. And as a per diem nurse, many of the patients Allison was tasked to treat were those that had been neglected by hospital staff or considered undesirable. A good number of whom you saw were dying from the disease, which later became known as AIDS. And when Allison heard that a ward was being built to specifically care for those afflicted, she immediately volunteered. These were, in effect, her patients already, and the ward represented the type of work which inspired her to originally pursue a career in healthcare. She was hired, becoming one of the original 12 nurses who launched the unit. Allison subsequently became 5B's nurse manager, and after 7 years on the unit, she left to obtain a graduate degree. Her ongoing commitment to public health ultimately inspired her to return to San Francisco General, where she became director of risk management until she retired. Within weeks of retirement, Allison found herself returning to her nursing roots, spending several years caring for her ailing mother during the last years of her mother's life, a fact for which she is incredibly honored. Today, Allison, who still resides in Northern California, travels to Morocco volunteering for a nonprofit that provides shelter and an education to rural Moroccan girls. She is joined by her wonderful husband, who we had the opportunity to spend time with last night. So, Allison, on behalf of our entire team, I would like to thank you for your caring style of leadership and your compassion for all. We are certainly grateful for all that you've done and all that you will likely continue to do throughout your life. And we could think of no one more deserving of our Hero Award than you.
Thank you so much. I'm so stunned and moved, and thank you so much for the recognition of my work and of our work. I really feel as though this is an award for so many people, so many nurses, and the people that we cared for. You know, many of whom are no longer with us. But thank you. I really, you've heard me go on and on. I'm speechless. But it's not me. It's a team. It's all of us. And as as you said, it's the leader is not a leader without all of those who support and who are part of the team. So
Thank you.
my husband.
And tomorrow we'll be honoring Brendan at our commencement ceremony. So this, we're so looking forward to it. Thank you for shining a light and really demonstrating why we are always voted as the most trusting profession. You really brought our story to life, and it's a wonderful opportunity for the public to get an inside glimpse of what it's like to be a nurse. So thank you. And thanks to all of you for coming today. It was such a 2 years in the making. It was definitely well worth it. And we wanted to bring Maggie up. Brendan wanted to see Maggie. Of course, I totally underestimated what popcorn nibbles on the floor would do to a dog who usually doesn't move an inch. And now she's been, but if you feel you need a little compassion on the way out, Maggie's always here for you. So thank you again for coming. I'm so appreciative. And thanks to the team that helped put this on. I mean, such an incredible, Gabrielle, Rose, all of our staff. Thank you so much, and have a wonderful afternoon. And for most of you, I'll see you at commencement tomorrow. So thank you.
You guys are wonderful. You're all so wonderful. Thank you so much.